Good evening, and thank you for dropping in tonight to tonight's town hall. I want to thank you for being here, and I want you to know I appreciate you taking some time to learn a little bit more about what's happening here in Santa Cruz County. I just want to just give you an update about a couple different things before we start tonight's meeting. As you may have heard, the county is going to be part of a large public safety power shutoff that PG&E is operating throughout the greater Bay Area. In Santa Cruz, most of the area is in the upper part of San Lorenzo Valley and the Boulder Creek area, but in the first district, it's the Summit area running almost all the way down to Corralitos. They expect that they will be turning off the power at 8 o'clock this evening, and they could turn it back on tomorrow, or it may not be until Friday. They're doing this because of red flag warnings, and there's something we know here in Santa Cruz is we have to watch out for fire. So I encourage you to go to the PG&E website. They have a nice way that you can look up with your zip code and address to find out if you're covered in this public safety power shutoff. And hopefully it'll be the last one of the year, and hopefully it won't go on very long, but we do want to keep safe. And it does remind me that, to remind you that just in August, our Board of Supervisors voted to change the way in which we spend money for undergrounding utilities. And now we are spending it up in the rural areas to underground utility poles, so they won't be an ignition source, and they'll actually improve the reliability of service. We expect that to be happening over the next couple of years, and it'll help protect our major evacuation routes. The other thing that I want to note is that next week, in addition to my regular meeting, I'll be having a number of folks who've helped us achieve some of our affordable housing vision, from the senior housing project at St. Stephen's Church to the new partnership we have with Mid-Penn Housing and the healthcare clinics to provide housing and healthcare in Live Oak. There's also going to be a public meeting that the County Public Works and Ecology Action are putting together. Instead of, obviously we can't get together because of COVID, but we're going to be having an online meeting on October 20th from 6 to 7:30 p.m. To create the first active transportation plan for the unincorporated area. This one's going to be particularly focused on Live Oak and Soquel. And if you get my newsletter, there'll be more information in this week's newsletter that comes out at the beginning of next week. But if you just set aside October 20th from 6 to 7:30, that would be great. Tonight, I'm really proud to have two important leaders joining us, two incredible women who lead our healthcare response to the COVID-19 pandemic. Mimi Hall is the director of our health services agency. She's just celebrating 2 years as a director, and it's been a tumultuous 2 years, but she has been a steady hand during a time of great need. And I'm glad to have her back on here tonight, as well as our public health officer, Dr. Gail Knoll. Gail's been with the county for 15 months, but as we were mentioning earlier, it seems like years, because there's that time before COVID, which we all remember fondly, and then there's the time after COVID, which seems like it's been forever. Tonight, we want to talk about where we are in the battle with the COVID-19 virus, and talk about some of the new ways in which we're trying to take a look at this and ensure that we have the best response possible. I'm really glad to have them, and I'm glad to have them in this leadership position. And our Board of Supervisors strongly supports the work that they are doing every day to keep our community safe and to address the pressing health needs of our community. Good evening, Dr. Knoll and Mimi Hall.
Good evening. Thank you for this opportunity. It's always a pleasure to work with you.
Yeah, we really appreciate being here. It's such a pleasure, and we are passionate about serving our community, so we're glad to be here.
All right. Well, I know you have a presentation that you wanted to share about where we are, because I think, you know, we're now 8 months into the pandemic here in Santa Cruz, and it'd be nice to know that so much has happened in just the past couple of months. I think we're waiting for the slides to go up. There we go.
All right, well, I'm going to kick it off here by giving kind of a situation update. And I hope that many of you are familiar with our website at santacruzhealth.org. It includes a data dashboard with many different panes, and I'm going to quickly go over them. It's really fun to go onto the website itself because it's all interactive. You won't be able to see that on these slides tonight. But in real life, when you are running your cursor over the screen, you can, for example, see the daily count of those aqua colored bars on our number of cases per day, and all kinds of interactive data presentations. Sometimes if you right click, you'll get a table instead of a graph. So I encourage all of you to experiment with this. These are cases from yesterday, from when I sent the data to the slides on when I prepared them. So I apologize, they're a day old. But our total known cases of COVID-19 are somewhere upward of 2,600 in the county of Santa Cruz to date. That's from the very beginning of this pandemic. So our earliest cases were identified in early March, mostly from international travel. But since then, as you can see by that big orange bar on the right side of the screen, most of our cases, 2/3 of our cases, are in person-to-person spread in a household situation. And of course, the COVID needs to come into that household somehow. And usually that's in a person-to-person close contact spread in a setting outside of the household. So friends, extended family, intimate partners, any of those are possibilities. Of the 2,600 cases, we have 215 that are active known cases at this time. So we know that our cases recover in 10 to 14 days in most of the time. And so at this given time, almost everyone is recovered. That's the following number, 2,383. And then deaths due to COVID, yesterday was 20. I believe today there's 23. 3 weeks ago, we had 10 deaths in the county due to COVID-19. But we've had this heartbreaking outbreak at Watsonville Post-Acute Center, a skilled nursing facility in our county, one of 7 skilled nursing facilities that we have. And we had an outbreak there that progressed very rapidly through the facility, as we have seen in other skilled nursing facilities in the state and across our country. These facilities are full of very medically fragile people, often very elderly, and very susceptible to death due to COVID. So we've had a significant increase. I know there was a question already of how many of those 2,618 cases of identified COVID-19 required hospitalization, and to date only 165. And that's a very low number, and our death rate is very low as well in this county. And there's growing evidence that perhaps that's from the protection of face coverings. Our community has been exceptionally good at following the guidance about face coverings. And there's growing evidence that face coverings protect not only the wearer, but also the people, or not only the people around you, but also the wearer themselves, which is new information for us. And it's felt that by wearing a face covering, we get a lower inoculum when we're exposed to the virus and perhaps get less sick. And that could explain the lower rate of hospitalizations and deaths in California and in Santa Cruz. So next slide. In our age bracket, the upper left-hand corner, you can see that the 20 to 34-year-olds are more impacted than other age groups. And that's understandable in that this age group wants to be out and about and visiting with friends and are more physically active and socially active in general. But we need to remember this is also the age group that tends to be frontline essential workers. So they are the certified nursing aides that are working in the skilled nursing facilities. They are the clerks who are stocking the grocery shelves. So those who are out in the front line are more likely to be in this age group. And then look at the bottom left-hand side, and you can see that even though our Latinx population is only 1/3 of our population in Santa Cruz. They comprise almost 2/3 of the cases. And this is true also across the state of California and much of the nation, that our communities of color and communities with lower socioeconomic status tend to be more at risk for COVID. And we're going to talk a little bit more about that yet here. And next slide. This is a map section that tells you geographically where the cases of COVID are. And when you have an active site and your cursor, you can run it over the different zip codes. And the zip code that is light blue there, 95076, and Central Watsonville as well, those have by far the greatest number of cases, far disproportionate to any of the other geographic areas. And next slide. So this is our equity page, also found at santacruzhealth.org. And the gender has a little bit of impact on disproportionate effect of COVID, but not much. But look at the bottom left-hand side, and you see that again, the Hispanic Latinx population, the little vertical bar is where we would expect the case numbers to land based on the proportion of Hispanics in our population, but instead it's almost twice as big. And so all of the other race and ethnicity categories are much underrepresented. And then on the bottom right, you see region, and you see that South County is more than doubly impacted disproportionately. Next slide. This is a model that our epidemiologists run every week, and it has to do with the number of hospitalizations in our county and predicting future hospitalizations, which we want to watch carefully and predict if possible so that we can know when we might have a surge and prepare for that in our hospitals. Because of the Watsonville Post-Acute Center, we've been less able to predict because this gray area on this model shows that we had quite a big peak due to the residents at Watsonville Post-Acute who needed to be hospitalized. That is correcting downward a bit right now, and we're hoping that we're going to stay closer to that dark blue predicted line, which is a manageable hospitalization number, and not move upward on that light blue confidence interval. Next slide. This is something that we watch closely. It's called the reproductive number, and we want to be down in the green or as close as possible to 1.0 or below. And what that means is that for every positive case, that just one additional person will get the disease. So if we're doing a good job at testing, contact tracing, case investigation, isolation, and quarantine, for each case, we hope that we're only going to have one additional case or fewer. So when we've had the best results in our community, it's when we're down in the green. So back in April and early May, before the summer hit and before people were more active and mixing more. And then also in August, before the fires, before Labor Day. And since then, we've been up a little bit, but it looks like we're trending back to the 1, which is excellent. And next slide. And I think Mimi's going to take it from here and talk about the state's tier system. Thank you, Mimi.
Thank you, Dr. Newell. Hi, everybody. So the state has something called a blueprint for a safer economy. And we actually really appreciate it at the local level because it's grounded in science. And it allows local communities to understand what's open and what's not, and where our trajectory is heading. So there are 4 levels of county risk: widespread, substantial, moderate, and minimal. And you can see that there are 2 main indicators that determine what risk level a county is in. And so the middle column that you see for new cases, that's the number of cases per 100,000 population. So a county that's purple or widespread, which is the highest risk level and the most stringent or restrictive economically, you have a case count of more than 7 per 100,000. And I have to move my cursor. And for testing positivity, so positive tests or testing positivity is the proportion of positive tests compared to the overall tests that you provide. So you can see that there's 7 for widespread, 7 per 100,000 new cases and 8% positivity. And you can see all the different tiers going down from red, orange, and yellow. Right now, Santa Cruz County we started in the purple range. When the blueprint was first released at the end of September, many counties, including Santa Cruz County, were in the widespread. And we have made a lot of gains, as you can recall from the epi curve that Dr. Newell reviewed before. Even with the Watsonville Post-Acute Center skilled nursing facility outbreak, we have this downward trend and a flattening of our curve. And we do believe that it's a result of the actions that people are taking. Next slide. So if you go to Blueprint for a Safer Economy, you're going to see an interactive map on the state website that has all of the states. And every Tuesday, counties' data is released to let them know which tier they're in. And in the public health world, we affectionately call Tuesdays Tier Tuesday. And so for Tier Tuesday, again, every member of the public can go to this website and put in their county or run their cursor over the counties and find out where they are. So as of October 13th, the statewide case rate was 6.8 cases per 100,000 people, and the statewide positivity rate was 3.4. Next slide. For Santa Cruz County, our particular metrics were 4.7 cases, new cases per day per 100,000. And it's adjusted, every county's case rate can be adjusted depending on a number of factors and what the total statewide case rate is. The positivity rate for our entire county is quite low, 2.2%. But I'll talk in a little bit about a health equity metric. And the testing positivity rate for our lowest quartile of Healthy Places Index. So basically our lowest scoring census tracts according to socioeconomic status and life expectancy are testing at 3.4%. So the state provides us information week by week, and their epidemiologists review the data for each county. And then we're given an embargoed copy every Monday evening. So Tier Tuesday, we're ready for what comes next. So you can see that from the last 4 weeks and the 3 weeks prior to the information being released, we have been in the red tier. Next slide. So as far as testing goes, I think it's really important for everyone to know that even though earlier in the pandemic, there were a lot of issues with testing availability, we worked really hard in Santa Cruz County to build our own system of testing. So there are currently 19 local outpatient locations that people can get a COVID-19 test. They include 2 CVSs, the Ramsey Park OptumServe site in South County, Westside Pharmacy in Santa Cruz, and all of our federally qualified healthcare centers. Salud Par la Gente is particularly noted because they do expanded testing for us. One of the things that I want to acknowledge, I'd like to thank UC Santa Cruz. They have been an incredible partner in having really widespread testing capacity for us. So they early on got certified to have a clinical lab at UCSC, and through a partnership with some of the funding that we got from the federal and state funding that we got for COVID, we partnered with them to double their lab testing capacity. So we're in a situation in Santa Cruz County where it's a great thing that the state and federally supported testing sites have come up and are expanding. but each one of our federally qualified health centers, our own clinic, and all of our hospitals in some way, shape, or form rely on UC Santa Cruz lab, either for their primary testing or backup testing. And we have had to use them when we've had lab equipment go down in some of our other facilities. So right now we have a current testing capacity of about 500 to 600 daily tests in the county. And that number changes based on availability of supplies, all kinds of things, but we're not bumping up to utilizing our full capacity. With the addition of expanded lab equipment at UCSC, we could potentially double that, especially when they're able to utilize their recent approval for pooled testing. Next slide. So what are our main messages today? It's really, really simple. All of us have the power to partake in simple acts that will make a really, really big difference, especially as we come into the fall and winter months. And we expect that what Dr. Ghilarducci, our Deputy Health Officer, has coined, he probably got it from somewhere else, but as the twindemic. So it's really important for us to all wear a mask. I think that that's one of the very most important things. Maintain at least 6 feet of distance between others. Wash our hands often. Try to minimize the amount of mixing we do with people outside of our own household. If you must get together with folks, keep your interactions brief, and outside is best. And we're asking that everybody make sure that they get their flu shot this year to help the healthcare system as we try to make sure that we have enough capacity to care for everyone in the coming months. Next slide. I think you can go to go.
Well, thank you, Gail and Mimi. We've come a long way in the last 8 months, especially building our testing capacity, making sure that people can get tested easily. Knowing, outside this outbreak, which has been devastating at the Watsonville Post-Acute Care Center, our hospitalization numbers have generally been pretty good. And I know that early on in the pandemic, we were very worried about the capacity. There was a lot of concern that we didn't have enough ICU bed space. And as I look across the country, you read these statistics every day about North Dakota, South Dakota, Montana, Utah, where you see that their rate per 100,000 is 40, 50, 60, I think it's 70 in one of those states. And you realize that ours is at 4, or a little bit more than 4, but you can see the difference that this pandemic has had in Santa Cruz County. One of the things that I think has been really important in addressing this is we've seen a disproportionate impact of this virus in Watsonville, and especially in the Latinx community. You pointed that out. How does that play into the planning that we've done here in Santa Cruz, and how does the state look at these kind of metrics to figure out where we should move in this tier system?
Yeah, thank you for asking that, John. I wanted to mention that, so the state does have a new health equity metric, and the purpose of having that metric is for counties to have a system and a tool to take a look at where COVID is most impacting communities, and oftentimes it's communities of color, communities with low socioeconomic status. And this wasn't a surprise to us. It's actually something that Gail and I and our colleagues had been lobbying the state to include for quite some time before they came out with it. And the state spent a lot of time working with locals about how to roll this out equitably across counties of different kinds of sizes. But very, very early on, first of all, I have 2 sets of appreciation to provide. One is to Dr. Newell, because she was clear and firm in her resolve that our early actions would help serve us and our community for the long run. So we were one of the very, very first counties in California to declare a local health emergency that the board subsequently approved. And then also one of the first counties to have stay-at-home orders, absent any orders coming yet from the state back in the beginning of March. So I do believe that that resolve and that quick action helped keep overall transmission low over months so that we could be where we are today. I also want to thank Supervisor Leopold, because we couldn't have done what we did without your support and the board support in believing in science, listening to your public health professionals who do this for a living, who are trained in epidemiology and biostatistics, and letting us do our work in a way that protects our community. And by doing that, you all serve the community well. So early in the pandemic, we anticipated that we would see the same kind of disparities with COVID that we would see, that we have been seeing with heart disease, with diabetes, with all of these other diseases, because diseases don't happen in a vacuum. And we began planning early on, and we made it clear to our partners that where we saw communities more impacted by COVID is where we must necessarily invest more of our resources. So that went for testing, for tracing, for community outreach and education, isolation and quarantine housing, especially for low-income workers that live in multifamily households. So there's a lot of work that we did early on. So we're quite ready when the state came out with their new equity metric. Next slide. So the new equity metric is designed to make sure that counties, we talked about the tiers before, and being able to move into a less restrictive tier when your case rate or your positivity, testing positivity, reduced. So with the health equity metric, counties with large disparities are going to move slower through the tiers, because even if your county as a whole meets the overall metrics to move to a lesser tier, your lowest quartile of Healthy Places Index census tracts must also have that lower tier number. So what it does is it forces counties to concentrate their resources and their efforts towards the communities that are most impacted. And what I love to, the way, when we're working towards this and when it came out, the way I thought of it is, one of my favorite Martin Luther King Jr. quotes is, injustice anywhere is a threat to justice everywhere. And when this health equity metric came out, I was driving home listening to the radio, and one of the former CDC directors said something quite similar. Disease anywhere is a risk to disease everywhere. And that's exactly how you look at things in a communicable disease standpoint when it comes to public health. As long as you have small factions of disease somewhere and you haven't eradicated it or properly controlled it, your entire population is at risk. Next slide. So this is available at the state website and also at a website called Healthy Places, California Healthy Places Index. So if you just Google California Healthy Places Index, you will come to an interactive website that allows you to put in your zip code or your county and see what your county looks like in terms of the Healthy Places Index. And so the darker blue colors represent the lowest quartile of the Healthy Places Index. And this index looks at things like income, access to healthcare, transportation, education. Is there a two-parent household? It looks at so many factors that determine someone's life expectancy. And so we have our highest number of cases, or biggest proportion of cases in that in South County. And you can see that in South County, the quartile, so the tier of the quartiles is the lowest quartile is the darker blue. The second lowest quartile is the light blue. The light green is the third quartile, and then the highest quartile is the dark green. So much of Santa Cruz County is pretty affluent and scores pretty high in terms of geography when you look at our county map on the Healthy Places Index. But we do have our lowest quartile and our second to lowest quartile concentrated in South County. And then a small slice, I went and looked it up and I blew up the map on the HPI website because Gail and I were trying to figure out what that tiny bit of blue was in Santa Cruz. And that's actually 95060 zip code, and the census tract is right around the boardwalk. So it's kind of like a little drop in the middle of Santa Cruz that is our second lowest quartile. Next slide. So how does this work and what is the approach? The approach is kind of like a three-pronged approach in terms of it allows the approach to be granular. So it doesn't just chop up your county into like geographic regions. It actually looks within census tracts. So that means individual communities within each county. So all counties look different. And in some counties, you have a very low HPI census tract within a really wealthy area or right next to one. So it allows us to really focus in on the communities that we need to pay more attention to prevent spread of COVID. It's also validated. So every one of those indicators and the overall index is linked to a summary health outcome that I mentioned before, which is life expectancy at birth. And some of you, if you're public health nerds, may have heard the phrase how your zip code can determine your life expectancy. And these are all the factors, all these socioeconomic and other social determinants of health factors that go into the validation of each indicator. So the third prong of this approach is policy solutions. So each one of these indicators, whether it's environment, neighborhood, transportation, has a policy solution that helps support how we can improve the Healthy Places Index for our communities. And I would love for us, when COVID is over, to continue our focus on utilizing HPI as a tool so that we can get all of Santa Cruz County in the green. Next slide. Oh, this is a nice little metric of what this looks like. And so the dark blue line that you see on top, you can see purple, red, orange, and then yellow. And those are the 3 tiers from most restrictive to least restrictive. Those are the lines that you see across. The dark blue line you see is the testing positivity rate for our lowest quartile of Healthy Places Index census tracts. And then the dotted line that you see in the orange area is our county testing positivity rate overall. And this isn't actually recent data. I think this was taken from a few days ago, because today's update is our lowest HPI quartile is actually 3.4. So we are, as a whole, going down in our testing positivity, but also in our lowest HPI quartile. So what we're shooting for as a county, if we really want to eliminate disparity in COVID-19 disease, is we want these 2 lines to come together. So the closer they are together, the less disparity we have in COVID impact in our communities with a lot of assets versus our communities without as many assets. So next slide. So some of the updated information from the state is that, I don't know if you've all heard about Project Home Key, but it's a significant amount of funding to help us maintain housing for those impacted by COVID and also experiencing homelessness before and after COVID. So the county has, I think it's 17 shelters that we have stood up in a very short amount of time. And those shelters have provided isolation and quarantine. They've provided a safe place for very vulnerable individuals that either were homeless prior to COVID or experienced homelessness as a result of COVID. The state also released some updated guidance from the California Department of Social Services for adult and senior care guidance. And that's really important because our seniors are a vulnerable population. And then very, very recently, the state also released family entertainment center guidance. So now our playgrounds are open. And I believe it was yesterday they provided guidance on gatherings.
So the gatherings that the state is providing information on is they're asking that we all keep our gatherings to 3 households that are stable over time. So pick the 2 other households that you really want to spend a lot of time with through the holidays, and not switching it up, 3 different families at a time. And that interactions ideally should be brief, outdoors. If not outdoors, then with face coverings on, and to try to limit those interactions to 2 hours. Next slide. We've been busy doing a lot of things, but a few quick updates on our local response efforts is that we have been in daily communication for the last 3 weeks or more with California Department of Public Health, California Emergency Medical Services Authority, and the Watsonville Post-Acute Center. We've been very, very involved, even though we're not the licensing authority, the state is, in providing them with consultations, site visits, all kinds of things. We also are the entity that calls for mutual aid, and we have called for the National Guard and also other supports to support staffing so that they can continue providing care to their residents. We are focusing right now on a lot of education and messaging around seasonal flu coming up and the importance of getting a flu vaccine as we enter into these trepidatious months of flu and COVID. And we also provide regular support to the agricultural community and the Farm Bureau in partnership with our Ag Commissioner, Juan Hidalgo, and continue to help them as employers and also focus supports to their workers. Finally, we have always had, so I don't know how much all of you know about emergency preparedness, but we follow something called the incident command structure. And it is something that all emergency responders follow. And our operational periods last 7 days, and we have objectives for each operational period, but we have overall incident objectives. Obviously, for this incident, our overall objective is to save lives and reduce the spread of COVID. But one of our other overall incident objectives is to address COVID through an equity lens. And we've done that from the beginning of the pandemic. And we are now planning and building a whole equity team within the Public Health Department Operations Center response structure. And we hope to continue that within our agency and also support the county to do the same. Next slide.
Well, I just wanted to say something, Mimi. First of all, I really appreciate you and Dr. Newell for your warm acceptance and leadership when we declared racism as a public health crisis, because you understood the importance of equity in the decisions that we make, and your willingness to sort of take the hard look at where we spend our resources. Are they being spent in the right places? Are we meeting the need that we have right now? Becomes incredibly important. And I know this isn't just a this year type of attitude, but your warm embrace and just your willingness to sort of build these infrastructure within the health department really makes a difference. And Dr. Newell, your comments on the day that we passed the resolution were very heartfelt and important for us all to hear. So thank you for that.
Thank you for that resolution, groundbreaking, and I really appreciate you bringing that forward.
Thank you. I know you want to just talk about talk briefly about what's going on with the flu season and how that's going to affect our COVID-19 response, because that's what you call the twindemics. As a twin, I'm trying hard not to feel, exploited, but it is 2 things that we have to worry about at the same time.
Yeah, Dr. Neal, do you want to address that?
Sure. So the symptoms of flu and COVID are very similar. Usually respiratory illness, like with cough, fever, sometimes a rash or joint pain, but very much overlapping with each other. And it's even hard for healthcare professionals to tell them apart based on symptoms. And so many people who have the flu, who in other years might just stay home, knowing that they have the flu and knowing that they'll get better on their own at home, during a COVID pandemic may want to know one way or the other if they have the flu or COVID, and may come to the healthcare systems and seek testing and diagnosis, especially our children as they start to go back to school. And so we're expecting a pretty big impact on our healthcare systems from this. And we want to avoid that as much as possible. And so getting the flu vaccine is the best possible measure anyone can take to reduce their chances of getting the flu and impacting our healthcare system when sicker folks might need the care.
Great. Thank you. You know, this work is ongoing, and I know we're going to, even with the best case scenario of a vaccine coming soon, we still could be in something like this by this time next year, because you have to get the vaccine out and people have to actually take the vaccine before we are back to quote unquote normal. We have to get used to living with this virus for a while. We've had a number of questions. People can use the Q&A, and the time we have left, we'll try to answer some of those. They're trying to move around from the folks who ask questions to make sure there's not just one person who dominates. But I want to pick out some of the ones that I consider most important. There's an employer here that has over 30 Latinx staff, and he's wondering what he should do as an employer to educate on COVID or respond to infections. Do we have something that we offer to employers?
Well, we're happy to announce that our interactive website is fully bilingual as of this week. And we've always had everything translated into Spanish, but now it's fully interactive with a parallel Spanish-only website. So people can be directed to santacruzhealth.org and get a lot more information beyond just the data. There are many guidance documents and educational documents. We've also partnered with Salud para la Gente for general community testing, contact tracing, and education. And they have promotores that are able to go off-site and do some education. So that would be a good place to reach out. And then we have Spanish-speaking health educators at Public Health as well, who also do that kind of work. So the person who asked could reach out.
Great.
And one of the things that I'll add is if you go to the main website, there's like 3 widgets. They look like envelopes. I think that's what they call them in the technology world. And there's a widget just for employers. And on that, if you click on that employer widget, there is a whole employer toolkit with materials to educate your employees, what to do if someone should be positive, who to contact at Public Health. So there's a wealth of information there. And coming out very soon. So we have been working with a group of 50+ organizations that come together every Friday. They call themselves the South County COVID Triage Group. And Gail or I meet with them every Friday morning. And they have been working on developing messages specifically in Spanish for Spanish speakers, but from community members for their community members. And we're using some of the federal funding that we received to expand those messages in those communities so that they're culturally appropriate as well as linguistically appropriate.
Great, great. That's super helpful. I wonder, there's been a couple questions about asymptomatic folks. Both, do we have an idea of how many cases we've had are asymptomatic, and what's the state of getting a test? Because asymptomatic folks may have a harder time getting a test. And could you explain where can people find out if they think they've been exposed but they're not showing any symptoms?
Well, whether or not you have symptoms depends a lot on your age. From national data, we know that about 60% of children under 10 never show any symptoms, even when they're positive and are infectious to other people. And then around 20% of older Americans. So it's a spectrum of symptomatology. So the older you are, the more likely you are to get sick and show symptoms, to feel sick. So that's kind of the statistics nationwide, and we would expect that to play out in Santa Cruz as well. You're right that in the past, especially some of the The managed care plans like Kaiser and Sutter, PAMF, Dignity in our community have not been able to test asymptomatic people, including essential workers, because of their own lack of laboratory capacity. But at this point, all of those systems say that they are able to take asymptomatic people, especially if they're essential workers who may be exposed.
And the turnaround time for testing is pretty good these days. Is that correct?
Yes, it's generally under 48 hours.
Great.
So big
Great.
improvement.
So people are really following this new tier system, and our numbers look pretty good. But we've seen Santa Clara County going from, you know, the California's hotspot to now bypassing us and being in a less restrictive tier. So what will it take for us to get to that next tier?
Well, Santa Clara, Alameda, and San Francisco have all gone orange in the last week. And that's because their case rate, which is actually higher than ours, has been dramatically adjusted down because they are doing so much testing. So if more of our community members would get tested, hopefully appropriately tested, then we would expect our tier status to improve. We're already orange in terms of our positivity rate and our health equity metrics, as we just showed. So it's only our case rate. And if we can get more testing done, that can be adjusted downward into the orange as well.
So it's not a question of availability of testing. It's a question of people going in and getting tested.
That's correct. So at this point, our ability to test far exceeds the number of tests that we're doing. So there's lots of capacity there.
Excellent. Someone asked this question. I'm not exactly sure if it's factually accurate, so I'm just gonna share it with you, and then you can tell me if it's right or wrong. That our hospitalization per 100,000 county residents, the trend is that we're the top 10 worst in California, higher than Los Angeles. Is that because of the Watsonville post-acute surge that we've seen, or is that an accurate statistic?
I haven't heard that before, and I would question that statistic. For example, today, even with Watsonville post-acute, our census was only 18 in the entire county, all 3 hospitals. And it's hard for me to believe that even per capita, that's higher, one of the highest in the state. I would have to look at that.
Yeah, and he cites something from Cal Matters, so we could take a look at it. But we saw a big surge when you looked at that statistic, which people can look at on the website. You know, with the Watsonville post-acute care outbreak, we saw a big spike up in hospitalizations, and now it's starting to trend back down as we get control of that outbreak. That outbreak didn't spread to any other facilities, is that correct?
That's correct, so far anyway, and
Yeah.
we hope that is the case, but none of the other 6 of our skilled nursing facilities have had an outbreak of that
Right.
magnitude, yeah.
There's a question about testing, and is there a different kind of test? Are we going to have a rapid test? Is there going to be test pooling? What can you say about the nature of our test? I know UCSC, we had the chancellor on from UCSC, and she talked about the test being different there, and that they use different reagents and they make their own swabs, and so it's less impacted by some of the shortages that we've seen earlier in the pandemic. But is there new testing that's coming on, or new tools?
Yeah, there is. And actually, when you look at testing, like we look at a lot of things, you don't look for one solution, you look for multiple solutions, and some of them serve different purposes. So the beauty of UC Santa Cruz building their own system is that at a time when there's competition for all the reagents and everything of the usual lab machines, they weren't in that kind of competition. So very recently, the federal government began distributing to states the Abbott Binax antigen tests. And we have, I forget how many we get a week. We get a lot a week. I think it's something like 1,000 plus or more, maybe even 5,000 a week. And we're really looking, they're very easy to use. We've actually used them when we had our fire shelters during COVID, and the state came, they provided us with 5 machines, and they're, you can move them around. They're not gigantic like some of our permanent lab equipment. And so we use those to do testing for our fire shelters. And so antigen tests are more, they're not as great as PCR tests, and they're best used in people who are symptomatic. So they're a nice complement. So let's say that we have a cluster and we need to do diagnostic testing for those symptomatic in the cluster. They can complement, we can do different kinds of testing depending on the situation and save the PCR test for where they're most appropriate. But that's a really big boon to all of California and actually the nation, to have the availability of those tests. They're like little cards, they're portable. And you know, the reagent is in the card, and they're compact and they're easy to use, and they don't take a special lab clinician to run them, which is huge, because a lot of our problems are with finding staff. Everyone's fighting over clinical lab scientists right now.
It's a good time to get into the field if you're ready to do that.
Yeah.
We just have a couple more minutes left, and I wanted to ask about schools and what we've seen. Because of our tier status, a number of private schools have opened, but no public schools. Have we seen anything in that opening that's an indicator for the future? And what's the testing regimen for those folks?
So we have made an agreement countywide with Stanford University Labs to come to test all of our educators to do the required surveillance testing, which is all adults on school campuses or people like bus drivers. Anyone who has contact with the students must get tested. 25% of that workforce must get tested every 2 weeks. So over a 2-month period of time, all adults in contact in school settings will get tested. So it's similar to what we do with skilled nursing facility staff, but a little less frequent. And that started, it started last week already with some of our educating staff and Stanford, and went very well. And so that will be ongoing. And all schools are invited to participate in that. So the private schools as well as public and the charter schools. And so that's underway and solved our biggest barrier to getting classrooms reopened. Even the public schools, most of them have started doing individual sessions and small group sessions with higher needs students. So those who were just learning English, or those with learning disabilities or developmental delay, that's already happening in our public schools. And plans are underway to reopen classroom learning in some schools this fall still, and in others in January.
Yeah, and so people should check with their school districts, because they're the ones who ultimately make the decision. We just assist them in making sure that it's safe, that they have the tools they need necessary if they choose to open, right?
That's right. So they don't need the permission of the health officer or even the county superintendent of schools. It's up to the district itself.
Well, we just have a couple of minutes left, and I was wondering if you feel comfortable sort of gazing into your crystal ball and give us what you think might happen in the next couple of months as it gets colder, as people move inside, as the flu season happens. What might we expect to see in Santa Cruz?
Well, of course, we're concerned about flu season, as we've already talked about the holidays and people gathering more and mixing of households, and people being indoors more as the weather gets chillier. And so all of those are risk factors, along with the continued concerns about fires and air quality that make our lungs more susceptible to disease. And so we've been worried about this fall. Globally, we're seeing a big surge as anticipated, and across most of the nation as well. But in California, we continue to have a significant downward trend in our case rates, and we hope that it will continue that way. And a reminder that individual actions, the ones that Mimi outlined earlier, are the ones that really determine how we do as a community.
Great. And how about you, Mimi? What do you see?
Yeah, I echo everything that Dr. Newell said, but in addition to that, I have this great concern. If you look at how our county and our state has behaved in response to COVID,
When our disease curve goes down, people like to get out and they let down their guard. And so we've had this up and down disease curve. So my fear is that should we move into the orange, and it looks like we're on our way there, and it's due to really, really good work on behalf of everyone taking care of each other and themselves. My fear is that that happens, schools go back in session, and we have kind of like this confluence of flu season, activities moving indoors, and people growing complacent with and happy about a less restrictive tier and being able to do more things. And part of what got us in trouble before is that the state opened too many things too quickly at the same time. And so I hope that regardless of what people are allowed to do, that they think about those individual actions: wear a mask, keep your distance, try not to mix with too many different households, and just be as cautious as possible when you can.
Yeah, we all play a role in what the future of this pandemic looks like here in Santa Cruz. What we do individually affects us all. And so if people can think about their individual actions, think about how they interact, wearing the mask, washing the hands, it really makes a difference. And we've seen that so far. That's why we have such low case numbers. I just want to thank both of you for your ongoing leadership during these incredibly trying times. There's a lot of curves that's been thrown this year. A lot of you've assembled a great team. You've had the foresight to look ahead in this disease, to put the pieces in place that can really help our community. I think as you look at our numbers, we're doing well, but we can always strive to do better, because this isn't going away quickly, and we're gonna need to keep our guard up as we go through the winter and into the spring. And I just want to acknowledge the hard work that you put in. This is not a 9-to-5 job for either one of you. So thank you very much.
Thank you.
Well, I just want to let everybody know that next week we're going to have some partners in housing to talk about some of the exciting work that's gone on. Pastor Jim Lapp from St. Stephen's to talk about the housing project there, and a new partnership between Mid-Penn Housing and Diente's Dental Clinic and Santa Cruz Community Health Center. And I hope you'll join me for that. And then 2 weeks from now, we're going to do a little unusual piece. Wallace Bain's going to come in and interview me about what's been going on. And so Wallace is a great interviewer. And so it should be a very interesting time together. So I look forward to seeing you all. Thank you for your work. And we'll all see you hopefully soon with a mask on. Till then.